Okay. Hello, all audience. Is all the audience can hear me clearly? Can anybody leave some message? Okay, good day, good evening, everyone. I'm Alice. It's my pleasure to be your host today. And thank you for making time to be with us. So now we have like 10 viewers, so it's still rising. Maybe we wait for 1 more minute to make sure that everybody in our YouTube. Okay, good evening, everyone. Good day, everyone. Okay, before I start introducing our speakers, I would like to give all our viewers a brief introduction on who we are. We are a global team of mentees from the Leadership and Mentoring Program organized by Professor Nguyen Hong. We will routinely organize monthly meetings with various topics that aim to encourage young medical physicists to grow as future leaders with the help of mentoring system. To know more about us, you could easily find our webpage, Facebook, or Instagram links on our YouTube channel homepage. So you can subscribe us, like us, and welcome to join and follow us. We are happy to have you with us. We will be taking questions at the end of the 14-minute talk. If you have any questions or comments, feel free to leave them in the chat room right at the right hand of your YouTube page, or you can leave message on the comment section on this YouTube video page. So about today's speaker, Professor Magdalena Stoeva. She holds master's degrees in medical physics, medical engineering, computer science, and a PhD in medical physics of diagnostic radiology. She currently serves as the professor in the Department of Medical Image, Medical University in Plovdiv, Bulgaria, and having more than 20 years of teaching experience in university, international medical physics centers, and ICTP. Not only that, Dr. Stoeva is also an active participant in an international project under European Union programs and an elected member of the governing body of IOMP and IUPESM. Dr. Stoeva is also the editor-in-chief of Springer's Nature's Health and Technology Journal. Last but not least, Dr. Stoeva is the recipient of numerous awards, including the Leonardo da Vinci Award, the IUPAP Young Scientist Award, and the award of the Mayor of Plovdiv. Without further ado, let's welcome our speaker of today, Professor Stoeva. Her topic today is medical physics in time of crisis. So let's welcome her.
Thank you very much, Alice, for this nice introduction, and welcome to everyone who's online on this webinar. Good morning, good afternoon, good evening, as it feels appropriate. So today's topic, I would say, is quite relevant to the times we live in. Medical physics in times of crisis, and of course, what medical physicists can do in these times. My first slide, as you can see, shows a huge hall full of people. This is a picture of the very last Congress of Medical Physics and Biomedical Engineering that took part in June 2018 in Prague, in the Czech Republic. And I would say that for over a year, most of us have not been able to attend any such event. We all have moved to the virtual space, trying to cope with all the challenges and the risks, and of course, some of the benefits that it offers to us as medical physicists and as health professionals in general. So I decided to dedicate my topic on the way we live during these times of crisis. But at the same time, I would like to emphasize that this is not the first time medical physicists had to survive these times. So I guess everybody of you knows who this lady is, Marie Skłodowska-Curie, the famous lady of science, who we took as the patron of the medical physicists worldwide. Her birthday, the 7th of November, was chosen in 2013 as the International Day of Medical Physics, and since then, every year it is widely celebrated all over the world. So I have selected Miss Curie as my first slide with her thought that we all must believe that we are gifted for something and that this thing at whatever cost must be attained. I do believe this is the real case, and we as professionals and as humans as well should quite often go back to these words that she said more than 100 years ago. So Marie Curie's recognition for the world of medical physics is recognized globally by our professional society by selecting her birthday as the International Day of Medical Physics. And as you can see, it has been already celebrated for 8 years in a row, coming IDMP 2021 this year, with different topics on the subject, but all of them inspired by the contribution that medical physicists can do not only for our own profession, but also healthcare and the humanity and the humanity mission of medical physicists and this way contribute high quality healthcare services. So let me start about 100 years ago during the World War I with Madame Marie Curie and her well-known, or at least in Europe, the so-called little Curies. These are small trucks, small vehicles that Madame Curie managed to equip with mobile X-ray units, and she managed to prepare 20 such little Curies, and she sent them on the war, on the front line, to help soldiers being properly treated from their wounds during the war. And she not only prepared those vehicles, but she also equipped them with dynamos, this way making them energy independent and fully mobile. Apart from this, she did a lot of work in the field of education and training, as she trained over 150 women as radiology operators, including her own daughter, Irene, who later on also became a Nobel Prize winner. And in parallel to this activity, Madame Curie also constructed over 200 radiology rooms during the war, which also contributed to the treatment of all the patients. She started the basics, she set the basics of the radiation safety by sharing her experience drawn from the war into a book on X-ray safety. And last but not least, she invested practically everything she had in this idea, trying to use all the funds she received from her Nobel Prize, and including the gold Nobel medals, to convert them to cash and to buy more equipment to be sent to the war to help soldiers. So later on, years after the war was over, a survey was made, and it was assessed that as a result of her continuous efforts during the World War I, a total of about 1 million or even over 1 million soldiers have been treated through X-ray examinations during the war, which is a huge contribution to the health and of the humanity, and of course the military personnel. So as you can see, 100 years ago, in these very huge times of crisis, one lady who we consider the founder of the medical physics, the first medical physicist, actually set the scene for the further development of our profession in various different areas, including education and training, including building facilities, including working directly on the field, and last but not least, including the contribution to the well-being of humanity. Just a couple of years later, another pandemic showed up on the world scene, and this is the well-known 1918 Spanish influenza epidemics, which resulted in millions of people being affected all over the world. And this was quite an unusual, deadly influenza pandemic, which lasted for nearly 2 years. It infected over 500 million of people, which at that time was more than a quarter of the whole world population. The death toll from these pandemics is estimated to be somewhere between 40 and 50 million, but some other sources cite numbers as high as 100 million, making it even so far the deadliest pandemic in the human history. And even at that time, medical physicists stood at their of healthcare, helping the doctors and the radiologists doing their best in their jobs. So radiology in general, including medical physicists, which of course at that point of time were not recognized as a separate profession, but they played an important role in the diagnosis. And although at that point of time, the crisis, we did not have the scientific knowledge and the strategic management and the communications that we have today, medical physicists actually have been very much involved into the technical part of the crisis management, associated not only with keeping the equipment up to certain quality standards that existed at that point, but also in technical support and communicating the information. So at that point of time, diagnostics was primarily based on fluoroscopy and radiography. And like I said, although our profession was not well recognized at this point, this is one of the good examples of how medical physicists contributed during another period of global crisis. And here are some pictures from 100 years ago. I put a title on this slide, the French words déjà vu, which means already seen. And yes, these resemble very much to our current situation, although some of the protective equipment that people wear looks not so sophisticated as the one we currently have, but very much similar to what we are through, what we are experiencing right now. So with this slide, I would like to end up my examples of global crises, although there are a lot more, many that can be given as examples in this direction, where medical physicists could contribute or have contributed to the development of healthcare and the well-being of humanity. Many of them are associated with the World War II and some radiation accidents like the Chernobyl or the Fukushima. Everywhere, medical physicists have been deeply involved in resolving the crisis. And I would like to jump to my next slide, which presents to you the International Organization for Medical Physics and its global perspectives for the medical physicists and for medical physics during the COVID-19 pandemic. As you probably saw from the initial slide and from my presentation, I'm here with a couple of different hats. So from this point now, I shall speak as a member of the IOMP's executive body. I'm the chair of the Medical Physics World Board. And we are very deeply involved with many different activities at different levels during the COVID-19 pandemic, trying to help medical physicists worldwide to grow professionally, even during those difficult times, and to give them expert advice so that they are able to meet the challenges the pandemics are setting to them. So the IUMP's main objective as a responsible professional society dealing with health matters is to help the medical physicists, our colleagues all over the world, to get information about credible and authoritative resources to avoid people getting affected by the unsustainable information. As a result of this, IOMP started a very active campaign to help medical physicists fight the issues associated with the global pandemics. So the first thing that we do was the so-called assessment of the direct contribution medical physicists can do during the pandemics. As a result, we put a short list of 5 main items where medical physicists can contribute to efficient and effective diagnosis and containment. So these 5 shortlisted items are the following. Number 1, medical physicists can very successfully cooperate with radiologists in order to develop the imaging protocols for different diagnoses of the COVID-19. Number 2, medical physicists can cooperate with radiologists to develop evidence-based quality assurance programs for teleradiology, which during the times of crisis actually developed quite a lot and spread really globally. Medical physicists are also working with radiation oncologists to develop policies for treatment of patients infected with COVID-19, which quite is a very important case because of the overall health quality of patients, of oncology patients, pandemic. Then medical physicists can cooperate with the IT departments to create infrastructures for remote visibility. We can develop and grow our profession as much as possible under these quite unusual circumstances. And last but not least, medical physicists should be facilitated, and they can facilitate to work partly from home to reduce the person-to-person contact within the healthcare facilities. And with this, to the social distancing rule, which in general has proved to minimize the effect of COVID-19. So apart from these 5 shortlisted activities, 5 more, which we consider additional contribution that medical physicists can do. This is our profession, but which can be very beneficial for our colleagues worldwide. And webinars like this one. So contribution number 1 is in the area of the education and training. And the idea is to develop and implement remote learning programs and remote learning environments for pre- and postgraduate education in medical physics and related disciplines. Because many of you probably know that we as medical physicists quite often are challenged by doing jobs that are not directly associated with medical physics, but with various technical aspects that exist in the respective diagnostics or therapeutic departments. And number 2 is the scientific research. Medical physicists can participate in teams working on COVID-19 research, this way covering the technical part of the research and giving better scope of the possibilities our equipment can offer for the diagnostics and eventually the treatment of COVID-19 disease. Expert input from medical physicists, this is very important. The idea is that we as professionals in our area can contribute expertise as members of hospital or regional or national or even global working groups and task forces who are dealing with the COVID-19 situation. Then our activities are related to the medical equipment support and maintenance, where we all know medical physicists play a key role both in the assessment and the maintenance of the medical equipment. And last, the dissemination of information. Today's world is driven by the data and by the information. So everybody who tends to be a leader in today's society should be very good in dealing with information. And dissemination of information is a key point related to the filtering and disseminating of the proper information to the hospital staff and the patients. Because we as medical physicists work in a specific area that is, I often like to say, we are like translators. We are translating the machine's language to the medical staff and to the patients. This way, making them feel a bit more comfortable doing their jobs or being treated as patients. So this is a very important role, dissemination of information. So in order to meet all these criteria, the International Organization for Medical Physics developed several different activities which actually grew during the COVID period and based on the demands of our members from all over the world. And activity number one I would like to present here is the IOMP newsletter, which is a platform for the medical physicists to share our latest knowledge with our colleagues and with patients and colleagues from other disciplines information overload. So the idea behind the newsletter is that you get access to pre-selected and verified information related to either our professional development or education and training or scientific or organizational aspects. So this is all done by the IOMP newsletter, which started in April 2019, but actually got better developed during the COVID-19 pandemics. And right now there are about 15,000 subscribers to the newsletter from practically any country worldwide. And we are constantly getting more and more new subscribers, including, of course, young medical physicists that rely on our expertise as more experienced people working on the field to select suitable information to be presented to them via the newsletter. The second initiative we took was or is the IOMP webinars. So the webinars were launched initially in order to support the international medical physics community to help them with their professional development during the times of crisis. And the webinars officially started in May 2020, just a couple of months after the pandemic became global. And so far, there have been 18 different webinars on various topics associated with the different aspects of the medical physicist job. And of course, the IOMP put all their efforts to make an excellent selection of speakers, which I would say are all of them are globally recognized experts in their fields. So up to now for 18 webinars, so pretty much 2 webinars a month, we have practically covered every aspect of the medical physics work. The webinars have been attended by totally about 7,000 medical physicists, which gives an average of somewhere between 300 and 800 participants per webinar. And what is a very important achievement of this activity is that the most recent webinars are attended not only by medical physicists, but disciplines related to the diagnostics or therapy, which means that the information we are disseminating through these webinars is actually considered useful for other professionals as well. And we are not so limited to our own profession. So medical physics, you know, is a very interdisciplinary job. And as such, we expect and we finally managed to bring other disciplines into our own webinars, providing them with useful information of how they can improve during the COVID-19 pandemics. and our attendees are from over 100 countries worldwide. Just one last note on the webinars. The webinars recordings are freely available at the IOMP website and the social media resources, so they can easily be used by any one of you in case you need an expert advice in certain area of the medical physics. And to be honest, they follow pretty much the same scheme that you currently have with these mentoring sessions. So the speaker or the speakers have a total of somewhere between 40 to 45 minutes to make their presentations on certain topic. And then there are 15 minutes at the end of the webinar where attendees can ask their questions. And of course, they are answered online during the webinar. So the recording in both the main part with the speakers' presentations and, of course, the questions and answers section, which is also quite valuable. And what you can see here on this slide is the table that presents in more detail all the webinars that we have run so far. They are split in three main sections. The first one consists of 5 webinars that are dedicated to the International Medical Physics Week in 2020. And there is another such series of webinars planned for the International Medical Physics Week 2021, which is due at the end of April 2021. Then there are 12 webinars, the so-called IOMP webinar series, or the main series on various aspects of medical physics. And the very last webinar is the IOMP webinar dedicated to the International Day of Medical Physics, the 7th of November, Marie Curie's birthday, where we celebrated online together with our partnering organizations, as you can see, the IEA and our regional organizations as well. So this is from me as a representative of the IOMP. Just one last shot from the IOMP, a quick look of how medical physicists are distributed. So worldwide nowadays. So the IOMP was founded in 1963. And right now it grew to a global organization, which is an NGO of the IEA and the WHO. And we have 6 federations and 87 national societies. And medical physicists are distributed worldwide using this scenario and color coding, as you can see on the chart on the right-hand side of this slide. Most of the most dense medical physicists are in North America, where we have about 24 medical physicists per million population, followed by Europe with 11.5. And as you can see, the rest of the world still has a lot of areas to develop. So there is a great need of medical physicists pretty much all over the world. And probably this is a great opportunity for you to grow as good professionals and contribute to healthcare and bring more people abroad by giving them your good example of professional work in the field of medical physics. So IOMP does not exist on its own. It's in partnership with another big organization. That's the International Federation of the Medical and Biological Engineering. The two organizations together form the so-called IUPESM. That's the International Union for Physical and Engineering Sciences in Medicine. It just turned 40 years in 2020, and currently it represents over 150,000 medical physicists and engineers from all over the world, from over 100 countries all over the world. And the IUPESM is a member of the International Science Council since 1983. So this is pretty much a quite simple structure. IUPESM as an umbrella of the medical physicists and the biomedical engineers. So the two organizations working in the field of the technical part of healthcare form the IOPSM. So why I have included this slide? The reason to do this is because there are a number of activities under the IOPSM which might be of interest to you as young medical physicists. So IOPSM recently formed the so-called Medical Engineering and Physics Workshop, which is the newest initiative of the Union, and it is focused on experience sharing, networking, and collaboration between physicists and engineers. They are run on local areas regionally, and they target setting up the scene for further collaboration between physicists and engineers. So far, we have had two actual workshops. The first one in Taipei, Taiwan in 2019, which was dedicated mainly on new technologies, experience sharing, and artificial intelligence. And some pictures from the workshop. You may recognize some people from here as being some of your mentors. And the second workshop was in the autumn of 2019 in Rome, Italy. And this actually is probably the workshop that you would be more interested in because it was dedicated to the newly formed early career chapter. So this is the initiative of the IUPSM for young early career medical physicists and medical engineers, trying to organize collaborations between them and also between them and more experienced professionals in the various fields of medical physics and medical engineering, and also some pictures from the workshop. And at the end of the second workshop, the participants voted on a position statement related to the early career chapter, where they very strongly supported the formation of this uh, early career chapter under the IUPESM. And there were a couple more workshops that have been postponed due to the COVID-19, one in Moscow and one in Porto Roche in Slovenia. So with this, I would like to go also in the interest of time to go to the very last part of my today's presentation. And this is one book that we authored with Prof. Ng, and it is dedicated on medical physics during the COVID-19 pandemic. This is a very good end for today's presentation. So we started with how the pandemics looked like 100 years ago and how medical physicists contributed to the management of the pandemics, although at that point 100 years ago, medical physics did not actually exist as a profession. And we put the end of today's presentation with how medical physicists can contribute to the management of today's COVID-19 pandemic. This book is in a few weeks from now, and I have the idea is to collect wisdom from, we call them diverse talents, but I would also say experts in medical physics. The book covers all the main areas medical physicists are associated with, like radiation oncology, nuclear medicine, and of course radiology. training and scientific research are covered by dedicated chapters. There is a chapter on the IOMP and its global perspective for medical physics, of course. A few regional chapters representing the main regions of the way medical physicists are split under their regional organizations, starting with the Asia Pacific, and Middle East, Europe, Africa, North America, and of course Latin America and the Caribbean. Then we have a very good feedback from the medical physics journals. These are the official journals of medical physics regional or national organizations that are in official relation with the IOMP. The response and feedback from another organization closely working with IOMP, that's the Medical Physics for World Benefit. Of course, your own contribution, the early career medical physics experience, which targets a lot of your own feedback and experience, the mentoring group, and the very last chapter related to communicating leadership. This is something that you can use to inspire you in the field of medical physics and in the field of healthcare and you being good health professionals. So this is my last slide. I would like to say thank you. But before I finish my presentation, just a couple of personal words. When I was invited to this mentoring webinar, I was told that I have to find a way for you to be impressed by the profession, to find a way to motivate you in being better medical physicists. And I think that the example of those people, all those people involved in our profession, some of them not even knowing that they serve as medical physicists, is a very good example. But my personal advice would be try to be as interdisciplinary as you can. Medical physics is a relatively new science, but it gives a lot of opportunities. You can develop virtually in any area, started from education and training and academics and research to practical hospital work and clinic appointments. You can work with the newest technology, and last but not least, you can see the results of your work directly by the number of people that are being treated and cured. So these are my last words, and I'll be happy from this point on to answer your questions. Thank you.
Thank you, Professor Stoeva. Now we shall open questions to the floor. So please let me remind all the audience, all the viewers, if you have questions or comments, please welcome to leave your questions and comments in the chat room so I can read up for you. So let's hear for my personal, I think we can basically speaking, it is a webinar year, so many resources we can reach. So actually, I have a question for Professor Stoeva. So in our last conversation, I by chance know that you are actually an expert of holding webinars and online courses. So I would like to know that according to your experience, is there any kind of topics that would be not effective or efficient in the form of virtual training or course? And is there any drawback of virtual meetings, and how do you think we could conquer it?
Well, this sounds like a very good question and very prompt one, especially under the current situation. So I would say that both virtual and in-person presentations have their own pros and cons. They have the positive and the negative sides. We have to think of the virtual presentations as a way to reach to more people, because the in-person meetings, they're definitely much more effective in terms that we can communicate directly and we can directly exchange experience on site. Sometimes, equipment is also needed in order to be effective, but in-person meetings are related to some other drawbacks, mainly financially or logistically, because it is not easy to move people around the world, and it is not always possible to bring the best experts on site, and it is not always possible to bring all the students that need this type of training on site for various reasons, like I said, logistically or financial. So think of the virtual presentations and the webinars as a way. Maybe they are not 100% effective, maybe they are around 80% effective, but if you count the number of people that can access this type of information and can communicate with the experts, so in terms of this, they're definitely way more effective than just working in a small groups, although they are in person. So every time you face some difficulties with the webinars, just think it this way. The application of the IT technology hand in hand with medical physics gives you the opportunity to gather more people, to train more people, to get better feedback, and then also listen to the audience. The audience will tell you which are the topics they are really looking for, based on the number of subscribers, based on the number of questions you are getting at the end of the presentations, based on the feedback. So provide information and then analyze your feedback in order to be more efficient in selecting topics. I would say, based on my own experience, because I'm dealing with the technical organization of the IOMP webinars and some other activities as well. Initially, the topics that were more valued by the audience were topics related to new technology. But later on, I would say that our colleagues started referring topics related to their daily work, day-to-day work, because this is what gives you actual help in what you are doing as part of your daily routines as medical physicists. So topics and interest of people also changes with time.
Thank you. Thank you. Cannot agree with you more. Okay, so is there any audience or viewers have questions? If you have, welcome to leave message and let us know. So there is a question, how do you handle leadership in time of crisis if you are a junior medical physicist?
So if you are a junior medical physicist working in a time of crisis, I know someone, a very experienced person, who always like to say that crisis gives opportunities. So if you are a junior medical physicist and you are looking for your field in medical physics, the time of crisis is the best time that you can show your skills. I cannot say expertise because expertise builds with the time. So it is difficult to be junior and with a big expertise, but it is easy to be junior and with skills. And sometimes skills that are not directly related to medical physics can also be very beneficial. So like I said, try to be as interdisciplinary as you can be. I myself am first a master of computer science, then a medical engineer, and also a medical physicist. And my PhD is in medical imaging. So I'll try to combine knowledge from different sources, and this will help you have a more analytical thinking and be more efficient in your main job.
Thank you. Is there any questions? If you have, please let us know. And okay. So thank you, Professor Stoeva, and thank you all the participants, all the viewers, all the audience. We hope you enjoyed tonight and enjoyed the time as much as we did. And we're really looking forward to seeing you the next time. And if you haven't subscribed our YouTube channel or give us a like, give us a thumbs up, please do it. And also we have Facebook page and the Instagram page. If you want to know more about us, you can all see information there. So, there is another question. So, the use of chest X-rays skyrockets during the current pandemic to an unprecedented level. Is there any record on the same situation in 1918? Were there rules of physics, Professor Stoeva?
So unfortunately, there is no clear statistics of the use of X-rays during the 1918 pandemics. There are many books written on this topic, but like I mentioned in my slides dedicated to this influenza pandemic, it was very difficult to make any traceable records at that point of time, simply because communication was not at a good level. But definitely, there are subjective signs that the number of X-rays and in general the application of X-rays has increased by times during the 1918 pandemics, because X-rays turned into a major diagnostic tool in that case. They were even able to split the diagnostics of the Spanish flu into, as far as I can remember, 6 different categories based on the X-ray image produced by the patient. So it was used not only for discovering the for diagnostic purposes, but also for classification of the type and the severity of the flu. And like I said, at that point of time, 1918, medical physics was not really recognized as a standalone profession. So medical physicists were simply physicists that found their work in the healthcare sector or combining work in healthcare with another work in the field of pure or theoretical physics. As you know, I'm just opening a bracket, our profession was officially recognized by the International Labour Organization in 2012. So since then, we are officially recognized. Up to 2012, many countries had medical physicists as a profession in national registers, but that was not globally recognized worldwide. And going back 100 years ago, the role of the physicists, we call them medical physicists by the job that they were doing at that point of time, but they were actually appointed as physicists, was really recognized by the healthcare societies, because at that point of time they were taking care not only of the physical but also the technical part of the equipment and its application, mainly for diagnostic purposes during the pandemics.
Thank you, Professor Stoeva. Also, since we are going to the end of tonight's webinar, tonight's meeting, I want to thank Professor Stoeva. And though this year and this year, it's not a very easy time due to the COVID-19, but I personally feel very, very grateful, because thanks to the our Medical Physics Society, all the international organizations that, as a young medical physicist, it's really lucky to have so many online resources to learn and to let us to have the chance, like our program, like our leadership and mentoring program, to have these kind of platforms and courses that we could actually communicate with each other. And I always enjoy the time very much. So thanks all the audience, and thanks to Professor Stoeva. And to the audience, kindly remind you that if you still have any questions or comments you want to let us know, or want to ask Professor Stoeva, you could leave message to us, or you could email to us, just like the email that we present in the chat room. So I'd like to say thank you all, and bye-bye. Thank you.
Thank you. Bye-bye.
Bye-bye. Have a good day. Wish all of you have a good day.
Have a good day. Have a good evening. And enjoy your work as medical physicist.